women played a central role in the clinical studies associated with the HPV vaccines. Could you tell us something about those vaccines and the effectiveness of HPV vaccines? It's unusual for somebody who has done the studies and been a promoter of the vaccines to express that kind of concern. What are you concerned about?
CDC data shows that overall, all ethnic groups combined, pap smear screening, no matter how imperfect it is and how it doesn't reach necessarily everyone, it still gives us an incidence rate of cervical cancer of 8 per 100,000 women. Whereas if the vaccines were used without cervical cancer screening, the very best that we could get with Gardasil would be 14 per 100,000 women, and with Cervarix it would be 9.5 per 100,000 women. In women who receive Gardasil, 35% of those women lose all detectable HPV-18 antibodies in 5 years, but 38% of men lose all detectable antibodies to HPV-18 in only 2 years. What we know is that if you look at all of the women who get an HPV infection, approximately 70% of those are going to clear that infection all by themselves within the first year, with no help from anybody. You don't have to detect it and you don't have to make it go away. It's going to do it. The body's going to take over and do it. Within 2 years, about 90% of all of those HPV infections are going to clear all by themselves. Now, by 3 years, you've got 10% of that original group of women that have HPV infections that are left. And by 3 years, half of those infections have progressed into what we call a CIN 2-3 lesion, or a precancerous lesion. So approximately 5% of HPV infections are going to go into a precancerous lesion. So now you have that small group of women who have precancerous lesions. And now let's look at that moving into invasive carcinoma. What we know then is that amongst women with CIN3 lesions, so that's a little bit more severe than the other group, it takes 5 years for about 20% of them to become invasive carcinomas. That's a pretty slow process. It takes about 30 years for 40% of them to become invasive cervical carcinomas.